I'm Ginger Ketting-Weller, and I'm the president of AIIAS. This is part of the People of AIIAS series, where we get to hear some of the wonderful stories of our students at AIIAS. Each one is so individual, so unique, and we enjoy doing these. Today, I'm interviewing Dr. Muriel Matunga, and tell us where you're from and what program you're in here at AIIAS.
Well, I'm from the Democratic Republic of Congo, which is a Central African country. And here in AIIAS, I'm at the graduate school and I'm taking a master in public health.
So Muriel, tell me about how you came to be at AIIAS. You have come from far away and an unusual circumstance.
Well, I was working in a public hospital in my country as a pediatrician, but I'm a generalist doctor. And you know, where I did not like how things was going. I wanted to add more, so to do a specialization or a master in public health. Actually, I wanted to do public health. And I tried in many countries. I was admitted for the programs, but I did not get the visa. And then my mother came with an idea that I know people in the Philippines and they say that there things can go easily. I came to the Philippines and things went smoothly. But before that, when I finished with my medical school, I have one of my brother who was studying in India. He was telling to me that there are many opportunities for me there to do a specialization or a master in public health as I wanted. But I was, you know, I did not start from learning English. I was like, I don't want to spend time in learning English. I want a French country. But when I came here, I started in the English Center. I spent time there, but I was wondering if it was worthy. When I got to the graduate school, looking back, I understand that it was really worthy, not only for the graduate school, but also for the future.
So you had been a French speaker,
yes.
And you had not wanted to learn English, but then when you applied to AIIAS, you were told you had to go to the English Center, and that was a bit frustrating. And it's only after the fact that you see how helpful it was to you. Right?
Yeah, I was thinking about my life from where I came and here, what I will go, where I will go, what I will do in the future. And then I told myself that, what if learning English was a plank of wood I needed to build the ark, yeah, to be able to help people in the future, because that is what I want to do.
I think your metaphor of building an ark so that you can take people to a better place is such a wonderful metaphor as a physician and as someone who wants to work in public health. That's really beautiful. And English was one of your planks.
Yes.
How long did you spend in the English Center?
I spent 6 months.
6 months.
Yeah. Beautiful at the end, but where I was going, it was 6 months where I was able to figure out how things can be different, you know. When I was thinking about learning English, I was just thinking about the hard parts, but not the sweetest of that experience.
Tell me about your program. How has it been being in the public health program at AIIAS, Masters of Public Health, as a doctor going through the program?
Yeah, you know, when I was working or at the medical school, I thought that it was what I need to do health promotion, to do public health. Mm-hmm. But doing this graduate school, I understand that public health is more than medicine. We don't need just to know how to, ask a question or give a prescription. Mm-hmm. But in health promotion, we need first to listen more to people, to understand, to live with them, and then we can be able to help them. Mm-hmm. Yeah.
And you shared with me, as we talked before this interview, that your professors have really modeled listening skills for you.
Yes, that's something I really learned here in AIIAS, to listen to people. We have professors who are willing to listen. They spend their time to listen to the students, and that is amazing.
Mm-hmm. Now, that's part of building leadership in you. And AIIAS is specifically working not only to help people get their academic degrees, but to build the leadership skills. As you look forward, what is your vision for what you want to do? You will be soon completing in the next year your master's in public health, in health promotion specifically. And nutrition. And doing your project in that area. And then you have now the tool of English as a plank in your arc to carry people to a better place. What is your vision that you want to do with what you've received here at AIIAS?
Yes, I want to make my people back in country understand that they can do things better with the resources they have. Mm-hmm. And the English I've learned can help me knock doors outside to bring help, to people.
And what is the situation? What are some examples of things that you see in your country that you would like to help to change with health promotion and nutrition?
Well, when I was finishing my medical school, I did an internship in a village in one of the provinces in my country. Mm-hmm. And there, most children are undernourished. They suffer from malnutrition. But when you look at the region, they have big lands and fertile. Mm-hmm. They have water. But when you take a look, you cannot understand how these people, with all the resources God has given to them, they can live in such condition. Mm. So I want to work with them, for them to be able to change their life.
So they have the resources there that they don't have to be malnourished. They don't have to suffer from some of the illnesses and diseases. And it's a matter of you showing them the way to tap into their own resources right there. Yeah, wonderful. We're so glad you're at AIIAS. We hope that you will take out that mission spirit that you brought with you when you came and put it to work as you go back to your country to serve and to lead. Thank you.